The question, how do doctors select treatment alternatives for patients with medically unexplained symptoms? We all practice off-the-cuff healthcare all day long. First off, in philosophy the question comes up, can medicine really exist and what assumptions are required? The fact that we assume that all people are equal is the basis for all of medicine. The fact that my BP is say 120/80 and yours is as well doesn't preclude, for example, that my wife who has an 80/58 is in any way sick allows us to be who we are. So in your example, if a patient presents with symptoms that they are looking for assistance on, we start with processes, drugs, procedures and the like that we have either learned to be or have been suggested to be assistive to the issue. If the outcome is good, we succeed. If not, we move on to another one on the list. Creating the proper diagnosis is only placing a name on the group of symptoms and doesn't in any way alter the help we give. All the proper diagnosis allows us to do is to categorize the whole group of symptoms into a short word, so the next time all the symptoms are seen in a different person, we can, instead of listing the symptoms, we can say XYZ disease. It also allows us to put into the diagnostic bucket things like drugs, procedures and processes that work before on other people. It also allows us to communicate between each other easier. In reality, we are learning that cancer is not cancer at all. Cancer is going to be found in another decade to be a totally unique disease for each patient, and although some parts are common and might be treated through common processes, procedures or drugs, the best care will be created from that person's own disease and by their own custom solution implemented by their body. Just because we have identified what we believe to be a unique set of symptoms or the like doesn't mean we can't start to logically treat the patient one symptom or occurrence at a time until we either win or we don't. Dr. D. Check out the link below for a guide on long-term remission or to join in with the community.